This presentation is on clinical presentations for the feet and the toes. The first clinical presentation deals with the plantar fascia. A plantar fascia strain involves the plantar fascia, which originates on the medial calcaneal tubercle and inserts on the metatarsal heads. The main purpose of the plantar fascia is to maintain foot stability, specifically the medial and longitudinal arches. The plantar fascia gets strained or stretched due to forced toe extension, over depression during weight bearing, and as a result, this can be chronic and lead to a fasciitis. Signs and symptoms include pain at the origin on the medial calcaneal tubercle. The patient may complain of pain along its entire length. Pain at the heel when resting after activity. One common, very common symptom is pain when stepping out of bed in the morning, especially on the heel. And last but not least, decreased range of motion and strength, especially when going into passive toe extension or resisted toe flexion. Two special tests called the windlass test and navicular drop can give you more information with respect to the severity of a plantar fascia strain. Complications of a plantar fascia strain or plantar fasciitis include heel spur development over time, constant tension at the attachment of the plantar fascia on the calcaneal tubercle could lead to what's called a bony spur. Again, a heel spur is caused by excessive and prolonged plantar fascia tension, causing a bony outgrowth. The signs and symptoms of a heel spur are very similar to plantar fasciitis. However, there's more pain on heel strike, potentially, if you can palpate, through the fat pad in the heel, possible deformity. However, the heel spur may be present, but without pain. Tarsal tunnel syndrome is a clinical presentation involving the posterior tibial nerve and entrapment of that nerve in the tarsal tunnel on the medial side of the ankle. This could be caused and or exacerbated by fractures, sprains, swelling, and even pes planus or flat-footedness. Signs and symptoms include pain and weakness and all sorts of neural symptoms along the medial and plantar side of the foot. Oftentimes, patients complain of sharp shooting pains into the heel as well. Special tests that can be used to confirm tarsal tunnel syndrome include Tinel's tap over the tarsal tunnel or dorsiflexion eversion test. The next few clinical presentations deal with fractures. The first fracture is called a Jones fracture. And a Jones fracture is a transverse fracture at the base of the fifth metatarsal. Here's a picture or radiograph of a Jones fracture. It results from a direct blow or forceful impact upon landing. Another fracture that can occur on the lateral side of the foot is an avulsion fracture caused by a forceful tug or tension coming from the posterior, coming from the peroneus brevis or fibularis brevis. And again, this is an avulsion fracture where the tendon pulls off a piece of bone off the tip of the base of the fifth. Another fracture that can occur along the fifth metatarsal is a March fracture. It is caused by excessive repetitive trauma. It's common at the second or third metatarsals. If it happens on the fifth metatarsal shaft, it's considered not a Jones fracture, but a March fracture. Again, like we said, it's caused by repetitive trauma, training changes, or structural deformities. Calcaneal stress fractures is another fracture that can occur, and that's caused by repetitive impact during heel strike. Also, if the shoes don't provide enough cushion during heel strike as well. Ankle and foot fractures. One to note in the midfoot is referred to as a Lisfranc injury. And the Lisfranc area of the foot is between the row of tarsal bones, so your cuboid and your cuneiforms, and the bases of your metatarsals. Any injuries in this area are referred to Lisfranc injuries, and dislocations or fractures can occur at this area. This is typically caused when the person is in plantar flexion. There's an axial load, so the person has to be weight bearing, with a rotational force while there's a direct blow. So it is a complicated type of mechanism of injury, but it is a complicated injury. Mortons Neuroma is a condition that involves nerve entrapment between the metatarsals. Here's an illustration of a Mortons Neuroma. People that are predisposed to this include people that have what's called Morton's toe, which is a presentation where the second toe actually is longer than the great toe. And as a result, there's pressure. And if the pressure is ongoing, potentially a tumor or fibroma formation around the second or third interdigital nerve. So here's an example. Signs and symptoms of Mortons Neuroma includes intermittent pain in the region, radiating pain through the toes, decreased pain when not weight bearing, that increases with weight bearing, and changes in skin sensation in the area that is innervated by the nerve that's entrapped. A special test that you can use to confirm Mortons Neuroma is called Mulder's sign. Hallux Valgus is a posture related to the metatarsal phalangeal joint of the great toe. It's caused by degeneration and or a subluxation of the metatarsal phalangeal joint. It could be caused by pes planus, ill-fitting shoes, it could be genetic, or it could be the result of osteoarthritis or rheumatoid arthritis. Typically what you'll see is a lateral angulation, so hence the term valgus. Distal end of the toe goes laterally, so you have this lateral angulation. A bony growth, referred to in layman's terms as a bunion. Decreased range of motion into flexion and or extension, which then will affect a person's walking and running gait. And potentially extensor hallucis longus weakness. Another condition or clinical presentation that affects the great toe is called turf toe. This is typically an acute injury caused by a hyperextension, plantar flexion, or axial compression of the big toe. Signs and symptoms include, again, depending if it's a flexion or an extension mechanism of the injury, pain could be brought on by excessive toe flexion or excessive toe extension. The patient could complain of pain during gait, especially during toe off, and also more specifically if it's a hyperextension injury. With functional activities, the patient may also complain of pain while trying to stop. And on observations, you may notice some swelling, obviously decreases in range of motion, as well as heat, redness, and pain. There might be some possible instability depending on the severity of the injury. On the plantar surface of your great toe, you have two sesamoid bones embedded in the flexor hallucis brevis tendon, which could get irritated and inflamed. This clinical presentation is referred to as a sesamoiditis. It's common in people with pes cavus or pes planus, where there's more force going through the great toe. The one thing that, as a therapist, you need to be able to differentiate is what's called a bipartite sesamoid. In other words, a sesamoid that didn't fuse, so it's naturally in two pieces, versus a sesamoid fracture, versus just a sesamoid that is just irritated. Signs and symptoms of sesamoiditis or irritation of a sesamoid bone: pain with metatarsal phalangeal joint extension. Because this is on the bottom of the foot, the person's gait might be altered. And last but not least, pain with heel raises. In attempting to plantar flex, the flexor hallucis brevis tendon contracts and puts stress through an irritated sesamoid bone. The last clinical presentation is called a heel or stone bruise. In general, contusions of the foot. If it's on the heel, it's called a stone bruise, and it's typically in and around the fat pad on the plantar surface of the foot. Another contusion or area of contusion is the instep or the dorsal side of the foot, just on the dorsal surface opposite to the medial longitudinal arch. Obviously, direct trauma is the mechanism of injury for any contusions, but the mechanism or the impact could come from footwear when the contusion is on the instep or on the top of the foot, or it could be from stepping on a very small object with your heel. The signs and symptoms of some of these contusions: obviously pain, difficulty with weight bearing, especially if it's a